1 second. Yes, we're in. Okay. Anybody else here? Lynn. Okay. All right. So let's begin. Welcome, folks, to the 2023 Healthcare Now Medicare for All Conference. This is the One Payer States State of the States Saturday panel discussion and question and answer from 4:15 to 5:15 Eastern Time. We will repeat this workshop tomorrow from 2:30 to 3:30 Eastern Time for anyone interested in returning or recommending others to attend. My name is Chuck Pennacchio, and I'm president of One Payer States. Just on background, we are a 14-year-old consortium of 22 state campaigns, or 22 states, some with multiple campaigns. We've been working together for that time period since 2009. And we've had a great deal of success over the years, connecting with one another, sharing resources, building up each other's morale. And this is a continuation of that work. About 5 years ago, One Payer States reorganized herself from what was a rather loose coalition of monthly phone conferences into a 501c4. And we jumped on Zoom about 3.5 years ago and have been meeting more regularly. And we reorganized ourselves in terms of work groups so that our work is much more efficiently done. And for folks who are attending today and interested in getting involved, we do work that centers on policy, outreach, education and advocacy, communications, organization development. And so we welcome folks to reach out and to learn more. And I'll drop my email into the chat, but the web address is all over the place here. We've got it placed in a number of different places, but we'll make sure that gets out to people. So on background here, we have a 2025 target year of implementing truly comprehensive, guaranteed universal healthcare systems in at least 2 states, with the nation soon to follow. We are proud to update what's happening in a number of states today. And folks will come up and do so in like 3-4 minute chunks and bring you up to speed on the states of Colorado, Massachusetts, Maine, Minnesota, New York, Oregon, Pennsylvania, and Washington. The work that we do is based on our applied theory of change, that work that learns from Canada, where many of you know the province of Saskatchewan led the way to national Medicare for all for our friends to the north. Our theory of change is also based on our own history of social change, as captured in the progressive and New Deal eras, which involved state modeling, which led to national labor, suffrage, and healthcare advances, among others, as well as coalition building based on shared values, intersectional justice issues, strategic visioning, planning, and execution. We're leading the way of a multi-state, 2-track, meaning state and national, campaign for success. Complementing the remarkable work that's being done at the state level is a work relationship that we have with members of Congress. Previously, Representative Pramila Jayapal, who introduced the State-Based Universal Healthcare Act, and now it's being carried by Representative Ro Khanna of California. The State-Based Universal Healthcare Act, which we abbreviate to SBUHCA, of 2023, will soon be reintroduced. But it was known in last session as HR 3775, and the language would be very similar. So that's House Resolution 3775 from the 2021-22 Congress. We fully intend to get this legislation passed in 2025 to provide as seamless an implementation of state universal healthcare plans as possible. That means that we want to get financial waivers as well as an ERISA waiver, which is Employee Retirement Income Security Act, which will keep the states from being caught up in the court system. ERISA, E-R-I-S-A. You can just Google that and you'll find it, E-R-I-S-A. And then today you'll be learning more of how you can support this critical work at both the state and national levels. And you can find information in the meantime at onepayerstates.org. And having said that, our strategic work truly begins with the organizing credo of radical hospitality, radical hope, and radical love, whereby universal transformational justice is not only possible, it is inevitable. So the legislation that we'll be talking about more on the back end here is the national legislation with Representative Ro Khanna, and we will return to that topic and bring an update as to what's happening there. But for now, we're going to pivot to Barbara Pearson, who's out of Massachusetts, and Barbara has the special role in one pair of states of being the curator of the states and the activities that are going on at the state level. So Barbara, do you want to give us a quick overview as to what's happening?
Okay, can you see my screen?
Got it.
Okay, so I'm the curator of the map, not the states, okay? And this is the map. It's a snapshot of the state-based single-payer activity at around this time, as much as we can tell from people telling us. So basically, these are the active states. I think I see one or two errors. I'm looking more closely. And I had hoped that this could be, live online, but I didn't trust my internet to do that. So I'm just going to show you that when you come to this state, you hover on a state and it will get dark, see, as if I had hovered on Maine, and then it comes Maine, and you can say double click. But there's also a place on the menu bar to get to this as well, states, and this is the interactive map. I'm going to go back up one because this one is wrong. So basically, these are states that have current bills, to my knowledge. People can correct me from today, and tomorrow we will be more correct. So California, Maine, Massachusetts, Minnesota, New Jersey, New York, Oregon, Pennsylvania, Rhode Island, and Washington. And then Connecticut, these are ones that have had them recently or are in the process of having analysis studies and so forth, like Connecticut and well, you'll hear about Colorado and later, so the others. So this is, you can see down here at the bottom, this is the onepayerstates.org states, and that will bring you to this map. In addition to working on legislation in each of those states, we have states that have the possibility of using a ballot issue. And one of the things that you can click on from our interactive map are states that have the option of using different kinds of ballot initiatives. So Maine and Washington have used them in the past. The pandemic kind of got in everybody's way, surprise. And I know last year and several years before, Massachusetts has been running several non-binding ballot campaigns in various districts. So we chose districts of non-sponsors and then had their towns have it on their town, and then everybody passed everywhere. And so then we have a really good lobbying and bird dogging tool showing that your town, your district voted for this. We're also working on regional efforts, especially in the Pacific Northwest, Washington, Oregon, California, and possibly Hawaii. And we're also working in Vermont, New Hampshire, well, New England, to try and do that. So we can talk more if we'll find out from today. I don't want to talk too much because I have so many colleagues that want to speak too. We also have policy people with one pair of states who have been very, very helpful in terms, especially Kip Sullivan from Minnesota, who understands, who has made a taxonomy of the different kinds of bills. So not all the bills are the same, but anyway. So now I'm done for now, unless somebody has a question for me. And I guess, should we just go to Colorado?
We'll bring up our leader in Colorado, Lydia Guzman, Healthcare for All, Colorado. Lydia.
Thank you, Chuck, and thank you for the opportunity to speak today from One Payer States and Healthcare Now. My name is Lydia Guzman, I'm president of Healthcare for All Colorado, and I'm on the One Payer States board. I'm here just to update you on what's going on in Colorado because we are really thrilled and excited about the latest developments that are happening. But before I tell you about the current bill, I want to tell you a little bit about the prior work that was done with my representative, Emily Sirota, and Senator Hawkins Lewis. There was a Healthcare Savings Act bill of 2019 that created a task force that selected an analysis team to do a cost analysis. And they evaluated 3 systems, the current system, a multi-payer system, and then single payer, publicly financed, privately delivered option that provided universal healthcare coverage. Needless to say, that study resulted in the fact that a fully publicly funded and privately delivered healthcare system that covered everyone in Colorado yielded significant savings. So we built on that work. And now we're in a current year, if you can change the slide. House Bill 23-1209 is analyzed statewide publicly financed healthcare. And this bill currently has passed through the House, the subcommittee, the Appropriations Committee, the full House. It has been introduced in the Senate and it's going to the subcommittee of Health and Human Services next week on Thursday. So we're thrilled about that. But this bill will conduct a detailed analysis of the feasibility of creating a publicly financed, privately delivered universal healthcare system in Colorado. And it will look at how to finance a system and what the impact to the economic sector would be. It's said to be a holistic study of the cost and delivery of healthcare in Colorado. So it will look at some questions. It will look at how could a universal healthcare system in Colorado, what would that look like? What would be the impacts on the healthcare workforce? What would be impacts to the individual and community health? Where are the current gaps in healthcare and how could a single payer system address these gaps? So knowing about the prior study and the same analysis team that did that study will be doing this study, we're thrilled to death about the progress we're making in Colorado. I also want to just shout out One Payer States for your support, Colorado PNHP, the Colorado Foundation for Universal Healthcare, Healthcare for All Colorado Foundation, Healthcare for All Colorado Advocacy Board, and all of our grassroots supporters, because after this bill passes this year, we're looking for a ballot measure in 2025 or 2026. Thank you.
Terrific. Lydia, thanks so much. And Barbara for doing the overview previously. If folks have questions as we go along here, you want to do resource sharing, feel free to use the chat. And yeah, thanks for the shout outs. Really, I failed to do that at the very top, but thanks to Ben and Julian, especially for bringing us in to have this opportunity to share what's the exciting work being done at the state level. Next up, we've got Barbara Pearson coming back up to talk about Massachusetts for a few minutes. Barbara?
Yeah, so I'm just going to share, MassCare is our coalition. We have had legislation in both of our houses every year, gets introduced every other year, and it stays there for 2 years. So we got it in January before the deadline. And so there's a House bill and a Senate bill that will guarantee equitable health care for every resident of the Commonwealth through a single payer healthcare financing system. And it's everything you've heard. Coverage will be comprehensive, affordable, no co-insurance, no co-payments, deductibles, or other forms of patient cost sharing. In 2021-22, we had 82 of 200 co-sponsors. Our goal for this session is over 100, which it should hopefully take us over. And we're also, of course, targeting the leadership in the House and the Joint Financing Committee. We have a coalition of over 80 organizations. If you come to our masscare.org website, under About, it lists the 80 member organizations, the unions and advocacy groups and so forth. Some healthcare advocacy groups as well. including the League of Women Voters, which I'm very proud of. Okay. November, and then we had, already told you about the non-binding ballot questions that we did through Mass Care in 20 districts around the state. And so we're using those now, getting ready for our lobby day, which is going to be in the beginning of next month. And we're trying to make sure we have a constituent from every one of those districts where they voted in favor of the thing. So we do have a financial analysis of the bill that's right on the website and the Google report. So when we make these slides available, there'll also be a bunch of links for all of the states that are talking. Some of them will get in the chat today, but it'll always be available to you from the One Payer States website. So basically, we have Jerry Friedman, who lives in Amherst. We also have Bob Pollan, who lives in Allen, but Jerry did the state analysis, and he's just updated it again in February for the most current bill. And we're very lucky he gives testimony, so we're assuming that if in fact we get another hearing, he will be one of the ones doing the testimony. So I'm going to leave it at that. There's plenty of activity happening. We need as many people as possible, but there is a lot of momentum in Massachusetts. Hopefully we'll get over the hump.
Thanks, Barbara. Yeah, and again, folks, drop your links for your organizations in the chat. Lynn Cheney from Maine All Care. Lynn?
I'm going to stop sharing while we're doing that so that you can see Lynn. And I can also put things in the chat for people.
Well,
Maybe
as Chuck said, I serve on the board of Maine All Care. We're a nonprofit that was formed in 2010, and we're the only entity in the state that's established for the sole purpose of promoting the establishment of publicly funded health care for all Maine residents. There have been efforts over the past 20 years to implement state-based universal health care in Maine. These include 2 major fiscal studies that show that such a system would be economically feasible. We came close to having a single payer bill in 2014, which was passed by a significant margin in the legislature, but vetoed by then Governor Paul LePage, and came up 4 votes shy in the override. In 2020, we formed an advocacy arm to mount a ballot initiative, but the effort was halted largely due to the difficulty of gathering the required number of signatures in the time of COVID, which has been mentioned. It was sad. We worked hard and it just didn't happen. In 2021, a comprehensive health care bill vigorously supported by Maine All Care was drastically amended at the suggestion of a smart, politically savvy chair of the Legislative Review Committee, and it was voted out of committee as ought to pass. The amended bill is short and sweet. It creates the Maine healthcare plan to provide all medically necessary healthcare to all residents in the state and forms a board significantly with no insurance representation to oversee the planning, implementation, and administration of the plan. This bill was passed by a majority of both the House and Senate and became law without the governor's signature. But, and this is a big but, this bill may not be implemented until the state obtains a waiver for a state-based universal health care plan and receives federal financing to support the implementation of such a plan. California Representative Ro Khanna's State-Based Universal Health Care Act, SBUHCA, is the intended enabling legislation. And this means that Maine is in a unique position to have a universal health care bill that's triggered by SBUHCA. In the same session, the Maine legislature passed a joint resolution calling on the president and Congress to establish a federal waiver process for states in order to enable state-based universal health care plans. It specifically calls out the SBUHCA bill. And I suggest that other states might convince their legislatures to do the same thing. I think that would help the passage of SBUHCA and would probably help the states as well. And it was something that passed easily in both the House and Senate and by a wide majority. A constitutional amendment that establishes the right to health care in Maine is before the current legislative session, and a hearing has yet to be scheduled. It will require a 2/3 vote in both chambers, and Maine All Care will testify in favor of this bill. And finally, Maine All Care recently contracted with the Maine Center for Economic Policy to update a 2018 fiscal study. And we'll be using this information to draft a plan with input from stakeholders and with the hope of submitting a comprehensive bill in the 2025 Maine legislative session. So I'm going to put links to the various studies and bills that I've mentioned in the chat, as well as a link to Maine All Care, which has a lot of resources in it. I'm happy to answer questions at any point.
Terrific. Thanks so much again for the exciting updates, Lynn. And there's a question that came to you in the chat if you don't see it, and also to Lydia. Next up, we have Ann Jones, Healthcare for All Minnesota. Ann? Unmute.
Am I doing this correctly?
You
Yes.
look good. Rock and roll.
Okay, so Ann Jones with Healthcare for All Minnesota. I am a retired registered nurse over many, many years. Decided to spend my golden years working on fixing how we pay for healthcare. Chuck said I thought I should have a story, but I thought if I wore the hat that I wore to an event that I did today, you couldn't forget what I said today. Well, it was a women's Rotary event, and I'm hoping to get a speaking engagement with them. Women business owners and entrepreneurs, I think, ought to be interested in this issue. So we are closely partnered with Physicians for a National Health Program and the Minnesota Nurses Association here in Minnesota. We reconstituted. Healthcare for All Minnesota went dormant in 2014 after the ACA passed, and they just weren't making any progress. We reconstituted with a new board in 2016, focused more on visibility, building our base, and getting out to events to build up numbers. So after 10 years with divided government, the Minnesota Democrats, which are the Democratic Farmer Labor Party here in Minnesota, held on to a small majority in the state house and a captured 1-seat majority in the Senate. For the first time in 10 years. We also hold the statewide offices as of 2022, held on to those. In early 2022 also, which we think will be helpful, all Democrats, of course, formed what they're calling a Minnesota Health Plan Legislative Caucus, specifically focused on getting a state-based plan passed in Minnesota. So we finally, for the first time, we have a longtime champion in the state Senate, Senator John Marty, who has written legislation for a publicly funded and administered universal healthcare system. This was reintroduced this year, just recently, with a new House, with a Senate sponsor and a new House sponsor. So we've also new for us this year as an organization was to take the step of creating a statement of legislative priorities and sending them to the Speaker of the House, the Senate Majority Leader, and the chairs of key committees. We've been connecting with these committee chairs and leaders and other advocacy organizations and issues organizations to support legislation that represents steps toward real progress. Let's see, is this not moving? What's the tendency toward what's politically feasible is a huge barrier to a real fix on this issue. Everybody on this call knows that. The best example I have is that we have a basic health plan in Minnesota. We're one of only 2 states that has that. We were allowed to preserve that after the ACA passed, and it's called the Minnesota Care. It was supposed to be a stepping stone towards single payer system for Minnesota. That was 30 years ago. So we were, as I said, we were allowed to keep this plan. Eligibility for Medicaid and Minnesota Care is still pretty low. Most people without employer-sponsored coverage are still forced to use the exchange, which of course was established in 2013, 2014. These are with commercial plans with a lot of financial risk in many cases. Democrats lost their majority in 2014, advocates stepped back, and costs just go up. So we've kind of taken the approach that we would try to teach both legislators and the public that there are that incrementalism is different from real progress. Are there steps we can use to get toward our desired goal? Yes, but we're trying to teach both legislators and the public how to recognize the difference between incrementalism and progress. And we drafted a set of principles that we want considered for actually focusing on bills that will get us moving in the right direction. So our top priority is to pass this year is our end goal, of course, is a Minnesota Health Plan, state-based universal health care coverage for Minnesota and a national health plan. We're actively working in that direction. Our top priority is to pass and fund a comparison of costs and benefits of a universal healthcare system. This has been introduced, funding has been determined, and likely will be moved to what they call the HHS Omnibus Bill for debate and action. We expect it to pass, and we expect it that we'll be able to assign that to an economist in Minnesota to work on. Other bills allowing undocumented persons to participate in Minnesota Care are moving toward passage. A bill with bipartisan support, which is kind of interesting, named the Freedom to Choose bill, would allow Medicaid recipients to choose fee for service rather than a commercial insurance managed care plan, which would help get the insurance industry out, at least for some people in public program. Another bill that requires a facility organized as a nonprofit to return charitable assets to the state if sold. We've got a big problem here in Minnesota with a proposal to merge with an entity in South Dakota. We need to hang on to our academic medical center. And then, of course, there are some proposals to reduce the cost of prescription drugs. It was recommended by a task force sponsored by the Attorney General a couple of years ago to set up a prescription drug affordability health, a board to control the price of prescription drugs. That's under some consideration, but needs to be stronger. And then we are also supporting and asking our members to support bills introduced by allies in the BIPOC communities and gun prevention advocates to help, build relationships with our allies. Everybody knows the bill attracting the most attention from the DFL legislators and other progressive advocacy groups is a proposal to expand Minnesota Care, our basic health plan for lower income working Minnesotans, that's being called the Minnesota Care Public Option, formerly called a buy-in. The rationale is that this tends toward the politically feasible argument and a belief that it could be implemented more quickly and that it would be a step towards single payer solution that we really want. Most people listening today know the pitfalls of the various public option proposals at the state and federal levels. The bill as written has some positives. We have some concerns, and we're trying to communicate those to sponsors and supporters of this bill without alienating current and future partners for reform, which I think is always a tricky solution for advocates of real reform. Our primary strategy until we can get some hearings and move forward toward real reform is to work toward building political power by inviting like-minded organizations to join us in coalition. And we are actively building that coalition right now to craft a campaign for a bill and pass and implement the Minnesota Health Plan. So just a little description of the steps we've taken. We're also working on city council resolutions. We've got 7 passed so far. Continue to volunteer at public events and do a lot of base building and working on relationships with legislators and candidates to increase our influence at the Capitol. But we really need the public to push. This I will end with quickly is a story worth reading about an incident involving a young man who was denied the care he needed by United Health Group, big, incredibly profitable insurance company here in Minnesota. And little detail about that. Yes, my closing thought for all of us is that we really have to build the empathy we need from the public and the sense of urgency to demand change and to combat this healthcare as a business and stop tolerating. I will end with some contact information.
Yeah, drop your links in the chat in that article.
Okay.
That'd be great. Yeah, we have to move on a little. Yeah, thank you. We'll take some of this up on the Q&A, and that article centers on a young student at Penn State University, by the way. Let's see. Next up, we have Morgan Moore with PNHP New York Metro chapter, newly inaugurated executive director there. Morgan, thank you.
Thanks, Chuck. Good afternoon, everyone. My name is Morgan Moore. Give me just 1 second. I got to get my screen open. I use she, her pronouns, and I'm the executive director of the New York Metro chapter of Physicians for National Health program. And I sit on the steering committee of the Campaign for New York Health. I've been involved in organizing for the New York Health Act for around 7 years. But as some of you likely know, the New York Health Act was first introduced in New York in 1991. After nurses with the New York State Nurses Association Union persuaded Assemblymember Dick Gottfried to author and sponsor the bill. And 32 years is a lot of time to cover in such a short time that I have today, but I'm going to do my best to hit some of the highlights. There's obviously a lot more going on as well. Since its first introduction, the New York Health Act has passed the Assembly 5 times, most recently in 2018 with a 2-to-1 majority, but it has yet to be brought to the floor for a vote in the state Senate, despite the fact that a few years ago we achieved Democratic supermajorities and have majority support for the bill in both chambers. In 2019, the New York Health Act was amended to include long-term care, which was the result of organizing in collaboration with disability rights and senior advocacy groups, and makes the New York Health Act unrivaled in regards to comprehensive coverage. The bill also includes reproductive care, including abortion and fertility care, gender-affirming care, and covers everyone regardless of citizenship status. No public programs, no for-profit private plans, no union plans, and no other current proposals can compete in New York State. 1 second. We've been able to make the progress that we have on the bill in the last several years due to strong grassroots organizing across the state, and that's been facilitated and coordinated under the leadership of the Campaign for New York Health through a distributed organizing model that empowers activists, both individuals and organizations, to organize around the bill in the ways that best suit them locally. We employ many different strategies and tactics in our organizing in New York. And so I just wanted to share a few slides from various events and actions and initiatives as examples and inspiration of what we've been up to. Throughout our organizing, we've focused on using the power of our stories to move people at their emotional core and demonstrate the interconnectedness of the various ongoing fights for justice and deep need for systemic change. We've focused in particular on uplifting the experiences of marginalized people and communities who are disproportionately harmed by our profit-driven healthcare system. Our chapter of PNHP New York Metro holds educational forums, currently held virtually to illustrate monthly, and we use those to illustrate the connection between the fight for single payer and the fight for health justice and human rights more broadly. Our organization and many others are also involved in organizing various universal healthcare town halls, community forums, teach-ins, film screenings, and tabling at various events. We also helped organize public hearings across the state a couple of years ago. We've held demonstrations. We continue to hold demonstrations, participate in marches, create interactive art experiences. We hold dance parties. We just had our 2nd annual New York Health Act bike ride through New York City. We do bird dogging. We've held die-ins and direct actions. We also annually hold a New York Health Act Lobby Day in Albany, mobilizing hundreds of people across the state to go and speak with our legislators. Here are some photos from some of those days. The last couple of years, they've been largely virtual, so that's been a new experience for us, sort of transitioning into advocating, in a digital space. Our media strategy has also pulled from the power of our stories. Last year, our chapter launched a social media campaign called Med Story Monday, and you can see a couple of examples on your screen now of that. And advocates have had a number of successes getting op-eds and letters to the editor printed. We've even gotten a single payer mentioned a couple of times in the New York Times, which is really exciting. And some of those examples are also on the screen. This past year has really been a transitional year with leadership changes in Albany. While Senator Gustavo Rivera remains our steadfast lead sponsor and champion in the state Senate, Assemblymember Dick Gottfried, our lead sponsor and author of the bill in the Assembly, has retired this past year, and Assemblymember Amy Paulin has replaced him as both the Assembly Health Committee Chair and sponsor of the New York Health Act. Rivera and Paulin have indicated that they'll be making some amendments to the bill before reintroducing it this session. And we expect that to happen sometime after our state budget is finalized. But frankly, the budget is testing everyone's patience this year. It's now over 3 weeks past due. And it's holding up all of the other matters until those negotiations conclude. New York State's legislative session ends for the year on June 8th. So there's going to be a lot to squeeze in a very short amount of time between the end of budget and June 8th. From our meetings with both of their offices, we expect that the amendments they'll be making will focus primarily on addressing labor concerns. And we're really looking forward to being able to review those amendments. The campaign's prior co-directors, Yulin Koshu and Ursula Razum, stepped down early in the summer of last year. And after an extensive search, the Campaign for New York Health has just this month hired a new executive director. So stay tuned for a big announcement to come from the campaign about that. We've, just as a little background, have had 2 economic analyses conducted of the New York Health Act, and I understand that there's another one currently in the works. Our chapter is also circulating a petition for New York City residents asking our city comptroller, Brad Lander, to conduct an analysis of the bill's impact on the New York City budget. There is also some really great labor organizing happening in the state. We have a new cross-org New York Health Act labor group beginning to meet, and some exciting organizing is being done by rank and file members. In particular, the UFT Moore Caucus has put out some incredible videos, and I'll share some links to those shortly. And lastly, I'd like to say, we really reject the attacks that are happening now on our existing public programs in terms of privatization and the attacks on the LGBTQ community, abortion rights, communities of color, people with disabilities, and the poor, and feel that we really must provide truly comprehensive universal care that's free at the point of service to eliminate barriers to care and eliminate the tiered and segregated insurance system that gives cover to and enables racism in medicine and really harms us all. The best way to keep up with the campaign is by signing up for their mailing list on their website, and I'll drop links to that as well as some other information into the chat now. Thanks.
Okay, Morgan, great visuals. Thanks for that. And yeah, everybody keep dropping links into the chat. And then at the end here, folks, be sure to save the chat, all this great stuff. And in the interim, you can actually open the hyperlinks if you don't know, if you want to take some action. We are asking for support for the work that we're doing at the state and national level. We're an all-volunteer organization, as one pair states. Next up is Linda Krygier out of Corvallis, Oregon, to speak to the work being done for Healthcare for All Oregon. Linda?
Thanks, Chuck. Yes, we've been having some exciting things going on in Oregon over the last several years. I'm Linda Krygier. I'm with the Mid-Valley Healthcare Advocates group here in Oregon. And our group has been working for over 30 years to support and implement universal healthcare or single-payer healthcare in Oregon. I think persistence and patience are 2 of the watchwords that have been underlying the work done here in Oregon. One example of that is the value statements that we have been continuing to maintain throughout this campaign. And those are actually codified in the language of the bills and the other legislation that's been moving forward. No, that's okay. In the last several years, as I said, we've been working for this for over 30 years, but in 2019, if you'll change to the next slide, Barbara, in 2019, we did pass, our legislature passed Senate Bill 770, which established the Joint Task Force on Universal Healthcare in Oregon, and a very hardworking group of task force members put together a detailed report that was presented in 2022 last year that shows the detailed benefits and cost savings. So there was a lot of work done to do a detailed financial analysis. Meanwhile, in I'll call it parallel action, Measure 111 was passed by Oregon voters in 2022. And that was a ballot measure that actually amended our state constitution, declaring access to affordable health care as a fundamental right in Oregon. And I think that was a real message to our state legislature that this is something that Oregonians are interested in and willing to fight for. Probably most exciting is what's happening right now. Senate Bill 1809 has been introduced this year in our state legislature. It's based directly on the Joint Task Force recommendations to establish a universal health plan governance board to get this work through the next steps and to implement or to present a plan for implementation of a universal health plan no later than September 15th, 2026 to our state legislature. Excitingly, that has been just last Thursday, that was passed out of our Rules Committee and is now headed for our Joint Ways and Means Committee. So that's serious progress we've made there. Just a few ideas about how we've made this progress and what we're doing going forward. We have, it's 1089. I'm sorry. I've got the wrong numbers here in my slides. I apologize for that. It's 1089, not 1809. 1089. What we're doing right now is really trying to stay focused, again, with that patience and persistence, stay focused on passing 1089, continuing to work with sponsors and supporters in Congress, as well as to maintain flexibility in those funding requests and work with people who have concerns about that funding, and organizing as we get closer to a floor vote, organizing the grassroots efforts to get our decisions and our needs known to the legislature. Once that's passed, we want to shift our focus to actually appointing a qualified executive director for that board, because that'll be really important. Getting the Universal Health Plan board put together, hiring staff, getting consultants, doing all the things that will really allow us to move this forward. And then staying engaged with that board as we did with the Joint Task Force. So one of our efforts in advocacy is to stay engaged with that board. We do recognize that there are some challenges we will need to meet as we move forward. Getting the funding that we need to do the bill, the work called for in SB 1089 is going to be a challenge that we're ready to continue to work for. The ERISA challenges that others have talked about, we believe that we have ERISA proofed our bill to the extent possible. And there's a great study done by Aaron Fuse-Brown and Elizabeth McCuskey that I'll put a link to that talks about how to do that. We will rely on waivers, of course, to continue our federal funding. So we rely heavily on that federal funding, and we will need to work hard on those waivers. And then finally, working with the public. Nobody wants to increase taxes, and taxes are a difficult thing to get people on board with. But we are convinced, and we think we can convince our public that the cost of doing this and funding this will be much less than what they're currently paying. Both employers and employees will be much less than what they're currently paying to cover their healthcare needs. So that's where we're at in Oregon.
Terrific, Linda. Thanks so much. Really good news coming out of Oregon, getting through the Rules Committee, and then potentially getting a vote done by June. This is you're fast tracking. I mean, this is really critical. That's why we need to align the work that we're doing at the national level with Congressman Khanna, and we also want to get a U.S. Senator running that bill. In the interest of time, I'm going to bounce over. I'm going to skip past PA for a quick second, other than to say that we've identified our House and State Senate leaders. Remarkably, Pennsylvania won the State House. No one saw that coming. We did a clean sweep in Western PA. Many of you know, we elected we flipped the only Senate seat in the country from red to blue. So we're proud here in Pennsylvania, but I'm the chair of the committee, so I'm going to take prerogative to give my time over to Maureen Brinck-Lund. So we have a few minutes for discussion on ERISA, and then there are a few questions we can yank out of the chat. So Mo, can you come up? Thank you.
Thank you, Chuck. Thank you very much. So my name is Maureen Brinck-Lund. Everybody calls me Mo for short, and I'm with Healthcare as a Human Right Washington. And I have to say, I'm a relatively new advocate in this space at all. And many of the people I am learning so much from are in this room at this moment. So I guess you can go to the next slide for a little outline. I'll talk more about HCHR a little bit at the end, but I wanted to start by just letting you know about the Universal Healthcare Commission that's been established in Washington State back in 21, and it's met for a full year and going on its second year. Much work was done in Washington State prior to this for years, for 30 years. In the 90s, we had a pretty good start on things, and then the majorities changed over. Between 17 and 19, there were multiple bills with multiple sponsors that, you know, they haven't passed the whole gamut to get through. Then the Universal Healthcare Work Group, which is really an important feature, worked for a year or two, I believe, but they came up with 3 healthcare models, really important to see. And I will put a link to that in the chat. The Universal Healthcare Commission, which is now established, and I, with Healthcare as a Human Right, I co-chair a subcommittee that is monitoring the commission. So that's kind of my space. I'm more informed on that perhaps than some of this other historical material and legislative material. So the Universal Healthcare Commission published its first report at the end of 22. And in this year, they've created the Financial and Technical Advisory Committee. And we were very proud of that happening. We also we've looked to Oregon's work a lot because they had 3 separate committees, one for the financial, one for technical, and the all-important public outreach, which we have not yet designed into our system. So you can go to the next slide, I think, Barbara. Thank you. So the prior bills there, and there are people in this room who were very involved in these bills. The Washington Health Trust Bill, which the commission has now agreed to review. We're really working on the commission in our subcommittee to review some of these other plans and bills that have existed before, so they can get busy creating a plan, so they can start moving forward with the federal government and other aspects of creating this plan. So both of these plans offer designs that leave space for the federal programs, design a system, and just have space for the federal programs to fill in. So the Universal Healthcare Commission is tasked with starting the waiver process as soon as there's a plan in place. And I should stop here and just say that our Universal Healthcare Commission was created with two goals in mind. One was to create a plan for universal healthcare, and the second was to create transitional steps that would move us, tighten up the system that's here already and move us towards the transition to the universal healthcare. We won't be able to do a universal healthcare plan without further legislative and governor signing off on one. But I don't have my picture of my slides here, so you can go ahead with the other one. Oh, yeah. So on to the advocacy work. Before I get here, let me please tell you that in order for you to find this information and much more, my colleague who has been in this group before, Marcia Stedman, has written up a beautiful piece that's accessible through that wonderful interactive map that Barbara was telling us about. So please understand that you can get all of this and much, much more through that map. I want to encourage you to use that map. And as far as our commission goes, we've been working hard with the commission, and we have had some successes in steering them in the right direction. But one of the things that's really remarkable about Washington State's commission, I think, is the leadership is a woman named Vicki Lowe. And Vicki is, she's the chair of the commission, but she's also the executive director for American Indian Health Commission in Washington State. And in her capacity in that tribe as a leader of the tribal benefits group, they designed a system that is essentially a single payer system. They got all people's different healthcare packages together. People are covered by a lot of different things in the tribe. And then they created a wraparound care so that everybody has basically the same coverage. And if you ask anyone in the tribe who their healthcare coverage is provided by, they will say, "Oh, I'm on the Indian healthcare." So it's like transparent, or not transparent. But it's like people can't see all the little healthcare things that are working for them under this umbrella, and they just know they can get the care they need. And by goodness, it is a very complicated system that Vicki had to work with. So in addition to that, we also have state employees on the commission who are very pro single payer. And we're really excited to have on our commission the head of the Office of Equity, recently formed Office of Equity. And then other members, we have the head of the Somali Healthcare Board on the commission. So we really feel like that has worked to our benefit, that to have a diverse community representation on the commission. So in our transitional steps, you can see this through the map, but we've done a number of things in 21, 22, 23. We created a public option. Now that's just like a transitional step in, we secured a 1332 waiver for undocumented immigrants, which is the first in the country. So they'll be able to be covered on a plan through the ACA. They were not ACA eligible, but they'll be able to get coverage through the exchange now. And 2023 budget passed in the House directs the exchange to revisit and figure out a way to draw down federal funds, which is similar to Colorado's, I understand, which included mandatory premium reductions, which ours does not yet. So we've created other boards, the Healthcare Cost Transparency Board, the Total Cost of Insulin Work Group, and the Prescription Drug Affordability Board, all of which are going to work in cooperation with the commission and each other to create more cost containment in our state. So I'm sure I've run over.
We're down to about 5 minutes to the end of the session. And so
sorry about that. I will put a couple of links in the chat, but please use the map to find the rest of the links. Thank you.
Okay, thank you. And let's see how to use this last 5 minutes. I did pull a few questions out of the chat. Some people want to. If you haven't done so, because a lot of people came in after the session started, could you rename yourself so everybody knows where you're from, please? That really is helpful. Your state, maybe your association. I also want to just throw a shout out. Phil Kim with California Nurses NNU is with us. Hey, Phil. I know a few questions came up regarding ERISA. What I think we will do, we will dedicate some concentrated time at one pair states to a dedicated workshop or two and really dig in on ERISA. We can't do it justice here today, in just a few minutes. I mean, it would take a good chunk of time to explain why ERISA is critically important, the Employee Retirement Income Security Act. I also noticed there were questions about how organizations are funding their studies. Folks who have those questions addressed to them can handle that. Maine being a small state, Lynn, a couple of people asked you, how do you deal with the size issues, the fact that it's a much smaller state? And then I did also want to swing back and really underscore the need that we need help in every congressional district in which you've got reach. We need to get every member of Congress to sign on when the bill drops, when Ro Khanna drops his bill. It's the position of one pair states. I know there's a debate back and forth. Who needs waivers? Do we need waivers? Do we need an ERISA waiver? Have we got a workaround? My position and that of one pair states is I'm an agnostic. We need those waivers. That's what we strive for. We want to get those waivers. It accounts for 50 to 70% of the total funding at the state level. For one thing, the financial waivers and the ERISA waiver. Do we really want to test the Supreme Court? Do we really want to test the Supreme Court and their corporate mentality and not have ERISA waivers? I don't think so. So my position and that of One Payer States, our official position, is that we've got to get those waivers. And I'm pushing on Kana to make sure that he makes that his point of emphasis and that his legislation has every opportunity to pass in the year 2025 as we sync up with Oregon and Washington in particular, who are ready to roll out their universal healthcare plans in 2025. We need to coordinate this work. We have to be extremely proactive. And so that's the position that we're taking here at One Payer States as the leading organization advocating for the states. We have just a couple minutes here left. Do any of our panelists want to come in and just say anything to the questions that were asked of you real quickly? Lynn, do you have anything to say about how do we deal with the small state issue?
Yeah, well, yes, we are a small state, but Saskatchewan was 1.3 million people and Maine is 1.3 million people.
There you go.
And both the economic studies we did, Mathematica and the Maine Center for Economic Policy, the links are in the chat, show that you can do it and save money. We're continuing, we're going back again and we'll still prove it. But I don't think that the money issue is really, although everybody brings it up, every study has shown that you can do it and save money. So that's where we are. We were fortunate in obtaining grants money for a part of the studies that we've done. And I would, and it also helps your supporters to go have a data set to go out and talk with. So that's why we're updating our report to go to the stakeholders. You can't just say, trust us. You have to have something current and in front of, to put in front of them.
Okay, thanks. A really good response, Lynn. And we are just about out of time. I'm just going to put out another personal plea to support the work that we do through donations as well as joining the work that we do. I've spent the last 4 months up in the Northwest. I voted with my feet. I live here in Western Pennsylvania, but I went out west, Northwest, to meet with people, to break bread. And then we're going to do a follow-up conference in the middle of the summer. This is really serious work that we're doing. And then we're going to convene state representative or U.S. representatives for the first time, U.S. representatives, and bring them together with state representatives to make sure that we're talking to each other across bands of governance and that folks are actually taking this stuff seriously. We need to model a universal healthcare system in 1, 2, or more states in order to convince the country that this has got to be the direction we go in creating a national single payer system. I'm convinced that this is the pathway forward. And so I'm going to move my way over toward Washington, D.C. I've got housing in rural Maryland, but it's a struggle. I'll be honest with you. It's a material struggle financially. And I don't get paid for this stuff. I'm just looking to get expenses covered. And that's all. And I pour every bit of what I have into this work. Many people, know who I am. I just want to put that forward, that this is the work that we've got to be supporting. I believe that we're on the cusp of a revolution here. We break out on this, and I think all other social justice issues are going to fold in behind us and with us at the same time. So thanks so much, everybody, for being with us today. Deep, deep gratitude, radical hospitality, radical hope, radical love. That's the way we go forward. Thank you, everyone.